You're listening to Age to Perfection, where we redefine aging, celebrate every milestone, and empower women to thrive at every age. We're so grateful to have you as part of our community. Don't forget to hit that subscribe button so you never miss another episode. Cheers to being aged to perfection.
Hi.
Hi.
Welcome back.
Thank you.
I've missed you.
I was surprised you asked me to come back.
Well, this is how this whole podcast thing started, because our marketing team listens to us argue back and forth, and they're like, we need this on video for everybody else to see. We are going to skip the wine today because
I'm getting old.
No, because the whole goal of today's podcast is to know when enough is enough.
Oh, wow. Yes.
Sometimes abstinence is okay. And sometimes just saying no to a glass of wine is okay.
I like it.
I wanted to take a moment to talk about weight loss. And I think a lot of our patients are doing weight loss right now. Mm-hmm. And the whole goal of weight loss is to look good and feel good. So we've had phentermine, we've had fen-phen, we've had, we've had all kinds of medications in the
diets, medications,
right? Like the Atkins diet came out, and then all kinds of things. Yeah. So we have constantly been trying to lose weight. And now I think we, for the first time, have GLP-1s, right? So from a medical standpoint, I think because me and you have a medical background, I think we understand how these GLP-1s work better inside our body as well as outside our body. Let's go over some of the good side effects of weight loss.
Yeah.
Why do you want to lose weight?
Because I love to shop and I look better in my clothes when I have a little less fat. So yeah, that's when I like to lose weight. But also, obviously, just as we're aging, it helps with joint pain. It helps you just feel better. You have more energy. There's just a lot of things that happen as when you're overweight.
Do you remember when we did anatomy and physiology? And I don't know if you did, but like that first week after the dissection, when you saw fat wrapped around every artery, every tendon, every like organ, I think 80% of the class went and joined the gym membership, because we know that when you have excess fat on the inside, it weighs down your heart, your kidneys, all of it, right? Mm-hmm. So now we have this wonderful GLP-1. Yes. We all started taking it, and then we all started looking good. And then at some point, we all started looking bad.
Mostly. Yes.
So,
because it's not selective.
Okay, so so why are we going from looking good to looking bad? Where is that disconnect happening?
I mean, I think not just GLP-1s. I think weight loss in general, right? So as soon as you're losing 10 pounds, maybe you don't notice as much. You're using 15, you're noticing a little bit more. But what you're noticing is it's not selective. Your volume loss is everywhere, right? So when you're losing fat, including your face, including your arms, your legs, and then you start to see the results of feeling better because you've lost all this weight. But at the same time, you don't really look all that much better when you've passed that point of weight loss where it's too much, possibly, right?
Do you feel like with your patients, do you advise them like, you know what, I want you to stay around this? Because
of course I do. They don't listen. They listen.
Everybody's greedy.
Well, because everybody wants that whatever is in this whole like idea that I need to be a size 0 or 2. That idea has not left society. I mean, I think as long as I've known it, skinny is pretty, right?
And up until now, skinny was pretty. But I think what we realize is this is the first compound that's actually, like you said, melting fat everywhere, not just in our bodies. Is everywhere. Yeah. So let's dive into kind of the bad stuff, right? Like when I think of beauty, when we initially think of beauty through the history, through the ages, we think of Marilyn Monroe. She started at a size 8. Mm-hmm. And we thought that was pretty. Then we evolved to Cindy Crawford. She's your stick, but she's still got that gorgeous, round, beautiful face. And then we got into like the Hadid sisters, that we just need like a cheekbone here and a jawline here, and then nothing else. And then we're done. And nothing else in between.
Yeah.
Do you feel like now with Ozempic we'll ever go back?
No, absolutely not.
Really? Even with all the people looking bad? I mean, there's some really bad Ozempic faces out there.
No, I think people just have solutions to that. We have solutions to that, right? Now they're coming here to figure out how to stay skinny, but not look skinny in their face, right? I don't think Ozempic is going anywhere. I think Ozempic is here to stay. I think GLP-1s in general are here to stay. I think it's a nice. And it has the benefits you were talking about, right? Like you feel better, inflammation, postmenopausal hot flashes. I mean, there's so many good things that it does. I don't think we're going backwards. I think this is here to stay.
I think so too. And I think what we're going to start seeing as practitioners is that we're going to have to tightly reel in at people, right? Like all of our patients that wherever the hell they're getting their GLP-1s, those are that are on it. We have this conversation actively with them. When you find out your patients are starting GLP-1s, when are you starting the Ozempic face conversation?
Oh, day one. Like right away. I mean, I let them know because I want them to know what they're looking for.
And if they are you doing ahead of time too?
Before they started, before they start Ozempic? Yeah. I mean, and I think because it's been around for so long, most patients are coming in because they see a friend or they see a family member or they know somebody or they've heard it. And so I think many of them are like, they have to be on Ozempic because they didn't look like that before, right? Because they're seeing it in their faces. And a lot of them are like, I want to lose the weight, but I don't want to look like that.
Exactly. So in our face, and we know Ozempic, we're losing not just the fat in our face,
right.
We're losing the muscle everywhere in our body, but even in our face, right?
Definitely.
Yeah. We're also losing, I feel like the reason Ozempic face looks like Ozempic face is because even our skin has fat in it.
Mm-hmm.
And I feel like you're also losing the fat in the skin, which is why some of the faces just look so like just
they're melting.
Yeah. Okay. So what are we doing?
Well, what
so
I'm
let's
doing,
let's take this step by step. Okay. Yeah. So,
the first conversation is also balancing, right? I keep trying to tell my patients, look, I know you want to lose weight, but you need to lose weight enough where you're healthy and where you look good, not crossing that threshold of where you start looking sick, right? We don't want to look sick.
No.
Yeah. That's my first point to them and taking care of their skin.
Okay. So a quick down and dirty for our patients. Let's go through. I'm coming in to see you. Hi, Dr. Nina. I'm about to start my weight loss journey. My doctor has given me Ozempic. I took my first shot last week. I'm really hoping to lose about 30 pounds. You know what? I have a wedding in like 2 months, so I'm going to try to lose it in 2 months.
That's fantastic. Everything's going to melt.
What are you going to tell me?
Well, I will usually let them know that if that is their goal, then what they need to start doing is they need to start an exercise program because I want them to keep their muscle mass. I usually tell them to pop in for True Sculpt Flex because it can build muscle and keep their muscle tone, right? Are
there specific areas you target with the Flex?
I usually target bigger muscles. So abs, glutes, or even the legs because of the laxity.
Let's go for the booty.
Yeah.
Because the booty melts first in Ozempic.
Yeah. The glutes are really, really, I would say the glutes and probably even arms because just the skin laxity helps tighten.
Yeah.
That's one thing. And then I like to really educate them on volume loss of the face. And so I really try to promote things like RF microneedling, things that are going to tighten, lift.
But RF microneedling melts fat. Why do I want to melt more fat?
Well, no, it doesn't. If it's done properly and at the right level, because if you have the Vivace, then you know where you're targeting. So I like to do that for volume replenishment, also just kind of keeping the collagen and the tightness. And then of course, Sculptra. Sculptra is one of my favorite, injectable biostimulators, and I try to get them started as soon as possible so that we can kind of stay ahead of it versus waiting for them to start to get that volume loss in their face.
Is there anything skincare wise that you're making them do for that?
Yeah, like firming serum. Firming serum, and I still like restorative skin complex with elastin, right? Because now their new formulation has actually proven to increase 1.0 cc's of volume in your face, which is the almost equivalent of 2 syringes of filler without actually putting filler in your face, right?
And it's oval, just like
exactly. It's all over, right? So I've really started to emphasize, hey, if you guys are starting Ozempic, you should be on firming serum, which is a polynucleotide, has the salmon DNA, really going to help with the growth factors, tightening, lifting, but then also adding the restorative skin complex to that to create some revolumization. So that's their add-on for sure. I love those 2 products for my Ozempic patients.
When are you starting? At what weight loss would you start fillers? Like, would you say, no, lose the first 10 pounds first before I put a little filler in? Or do you want them to completely lose their weight before you put filler in?
I would say completely. I think at the first signs of volume loss where they're starting to get the hollowing of the cheek or even the sagging, like seeing the jawline or to me, I feel like the first thing I see my patients have is the marionettes. Like this is where you really see kind of the fall, and this is the first area.
Because they hollow out and
right here, and everything just starts to kind of fall downwards. So I typically will let them like wait until I see them and follow up and to see if I see signs of that happening. Then I will advise them. But like I said, I gravitate a little bit more towards Sculptra, unless, like you said, the patient has a wedding in 2 months. Then we're probably going to do filler because Sculptra takes a while to see. But I always tell them after the wedding, we're starting Sculptra, right? It's always got to be a combination, not one or the other, but a little bit of both. But I would wait until I see some signs of it before I fill.
Do you feel like there's any age? Because we all talk about as we age, things are sagging anyways.
Don't remind me.
And now we're adding Ozempic to it to add to that sagging. Right. And we're adding to that melting of the face, and we're adding to that skin laxity. Do you feel like there's a certain age that maybe we shouldn't be doing Ozempic?
That's a tricky question. I mean, I think because it has so many health benefits, it's really hard to say that, right? Because anybody who's in their younger years, like their 20s or their teenage years or even their 30s, or having health issues, like, do we really want to stop them? Somebody who's in their 60s, 70s, like you go to the other extreme, 60s and 70s. I mean, heck, even my highly functioning 80-year-olds, I've got some women that are just, I'm like, can I be you when you're 80, right?
Yes.
And so I think it's more individual and lifestyle. So I don't know that I have a hard set age that I would say I wouldn't recommend it. I would just base it individually on each specific person and their day-to-day living. And if, they've got high cholesterol or they have diabetes or it's, their weight is impeding their activity level and they could be more active. No, I don't think I have an age for that. As long as they don't have any ongoing medical issues that they're contraindicated for. But
I feel like I approach my younger patients with Ozempic versus my older patients very differently. I'm a lot more aggressive with the older ones as far as like preventive, right? If I know that someone's going or is wanting to start it, then maybe I'll even go ahead and start filling them with Sculptra, not filler, but maybe with Sculptra. And maybe we will go ahead and start planning that collagen tightening. Should they do collagen tightening before they start it?
Always. Everyone's losing collagen after 30s. You should be doing it. Even if you're not on any weight loss, you should be doing it. That's a trick question. I think
it is a trick question. Okay. Last trick question. If I decide to stop Ozempic, but I've done all the Sculptra and the filler and everything, and then now my weight comes back, what's going to happen to my face? I get that question a lot. Well, since Sculptra doesn't make your face fatter, right? It just gives you more collagen boost, elasticity. It's help replenishing the things that are being lost as we're aging. Now, filler might be a different thing because fillers we know now can last in your system or in your skin for longer than what we knew back in the day when we were doing it. And so, yes, if you gain weight, I don't think it's going to migrate or do anything crazy like that. So I think it just kind of settles in with you. Ironically, I don't know that I know any of my patients who will get off Ozempic because they just love it so much. I mean, they go to microdosing, they go to like different. I think for the people that stop it mostly ends up being a financial decision.
Of course, yeah.
Than anything else.
Yes.
Because nobody wants to stop the Ozempic if given the choice.
But I mean, I don't think there's anything that we're really recommending aesthetically to keep up with their volume loss or to keep up with their elasticity that wouldn't help them long-term for aging anyways. So, I try to let them know that even if you do these things now and you end up gaining, 10 of your pounds back, you're still going to look amazing.
Okay. Body. We went through face. Let's go through body, right? Obviously, like you said, we want to shop. We want to look nice. We want to look good in our clothes and everything like that. What about the skin saggy that happens?
I know. It's terrible.
Like as a result of it. Knees and
all the
elbows,
all the things, all the things,
like right above the knees. Like the inner thighs start to get less.
I know. You don't.
All this.
Girl, put your arms down. Just trying to show me which. You don't even have any laxity.
Oh, I do.
So. Again, I'm going to go to step 1, which is at home. So body smoothing, Transform by Elastin.
What is that?
Absolutely love Transform by Elastin.
Tell us what that is.
It's going to help tighten the crepey skin, kind of keep the skin healthy and thick. So to me, I feel like everything starts at home first. So if you're not doing what you're supposed to be doing, I could throw the kitchen sink at you here and you're going to look better, but you could look even better and it can last longer. How long does this last is a popular question if you're doing the things you need to be doing at home. So I always start with that advice first. And then for body, I really like RF microneedling still. I'm going to go back to that because I love the idea that we can tighten the skin. And if there's little pockets of fat, we can still kind of modify our treatment to help go for that, right? Like people
don't forget Opus for that loose skin because that's still radio frequency. I love that.
And radio frequency. I feel like radio frequency is great for the body, right? Even TrueSculpt ID, we use that a lot, right? Just to
where are you using the ID? Because they're already losing the weight in the belly. Where are the pockets you're seeing that you're having to take the ID to?
I think still in the flanks and the stomach, but mostly it's the flanks, right? Because a lot of times when you're on Ozempic, you lose a lot of the truncal part of it, but for some reason the flanks and the back area still have a little bit of stubbornness. So typically I'm doing that, but remember it's also still radio frequency, maybe not as powerful as an RF microneedling or an Opus, but it still kind of smooths things out, right? So for like more of a smoothing. And then if you pair that with your flex for the muscle building, which is also kind of your skin tightens around muscle that you're building, all of those things are good for the body. It's not one thing. I feel like it's always a combination of things.
What should your flex regimen be? Let's say you're on a 6-month Ozempic, then that's your goal. You're wanting to lose 20, 30 pounds. But obviously we know how important muscle is, especially as we get older, right? Yeah. We not only are losing muscle, but our ability to build muscle is declining.
Of course.
And obviously that's why we have our testosterone and we have our, bioidentical hormones and all of those things. But how would you space out and how many to keep that muscle mass? Because that is so important.
In an ideal situation, I would honestly advise my patients to come twice a week to do it for 6 months.
6 months.
Heck yeah. I would love that.
Okay.
That would
only
be
Jeff Bezos has that kind of money. Okay?
I said ideal. Okay. But if I were to, all my patients, what I do for my new starts is if they're starting Ozempic, I try to at least get them to do the first series, right? Like we always do, twice a week, minimum of
a series of 6.
I say minimum of 4, but I ideally say 6. And the reason I do 4 is because then I see them for the next 2 like a week apart.
Oh, and so you just space it out a little bit more.
And it also helps me kind of gauge their weight loss journey and what they're doing and how they're doing with that. So I do twice a week for 2 weeks, then once a week for another 2 weeks to get that 6 in. And then I have them come back once a month so I can keep track of them. So more of like a maintenance phase. But like I said, depending on how fast they're losing weight, if they're losing, going back to your patient, that's got a wedding in 2 months. Yeah, she needs to come back twice a week if she's trying to lose 30 pounds in
I'm first and foremost going to talk her out of losing 30 pounds.
Of course, because that's not healthy to begin with. But at the same time, if you're determined to do something that I think that's more of a fad diet, because you're not just doing GLPs, you're also...
women, when we're determined to do something,
she's probably doing determined. Like Beyonce's lemon juice situation. That's just like an extreme. So I would say in that case, I would highly advise them to do twice a week, right? And probably just try to bundle some deal in because I'm motivated to get them to where they want to go without losing too much of their muscle mass. So that's sort of my protocol when somebody's on like your example of a 6-month Ozempic journey.
Perfect. Well, thank you so much for giving us all of the answers on how to not have Ozempic face, Ozempic body, but still actually look good. Because that's the goal at the end of the day is we want to look good and feel good.
Absolutely. Thank you.
Thank you.
Disclaimer. The information provided in this podcast is for educational purposes only and is not intended as medical advice. Please consult with your qualified healthcare professional to determine the best treatment options for your individual needs. Results may vary and all procedures carry some level of risk. Always make informed decisions in consultation with a licensed professional.